Assalamualaikum and very good morning. Today I would like to give a brief presentation with the title of Characterization of Breast Cancer Stem Cells in Mammosphere enriched from MDA-MB231 cells. My name is Nuramzia Razana binti Juman and together with my team from AMDI USM. Now let us start with the presentation. Breast cancer is a non-communicable disease which is also most frequently diagnosed cancer and leading cause of cancer death in females. A triple-negative breast cancer or TNBC, it accounts for at least 12.5 to 15% of all breast cancer cases and is negative for three biomarker expression of estrogen receptor, progesterone receptor, and HER2. So this makes them an aggressive form of breast cancer and that hormone therapy can be ineffective for TNBC treatment. Surgery to remove cancer from breast is usually the standard treatment for breast cancer. Apart from the surgical intervention, they are normally followed by supplementary treatment to eradicate or suppress micrometastasis. And these supplementary treatments are known as adjuvant therapy. So examples of adjuvant therapy are radiation therapy, chemotherapy, and also endocrine therapy. However, short and long-term effects may arise from each of these therapies, which can influence the mobility, function, and quality of life for the patients. Therefore, increased survival rates and life expectancy can be accomplished if there are improvements in treatments in terms of treatments for breast cancer. Even if the breast cancer cells is detected and treated early, some leftover cells may still survive and eventually can cause tumor recurrence. So these leftover cells are what we call as cancer stem cells. And these cancer stem cells can be discovered at any stage of the disease development and are in charge of producing therapeutic resistance. Only bulk tumor cells can be removed by chemotherapy or radiation therapy. Breast cancer stem cells are not eliminated and instead increase the percentage of breast cancer stem cells in breast cancers. The most often used biomarkers to identify breast cancer stem cells are CD44 plus and CD24 low or negative, and also LDH1 positive. It's therefore important for us to understand the biology of breast cancer stem cells in each tumor to help create better treatment options. Non-adherent serum-free culture is one of the many techniques that can be used to enrich cancer stem cells. The purpose of this current study is to characterize breast cancer stem cells enriched from MDA-MB231 cells, a TNBC cell line. As for the methodology, the cells MDA-MB231 cells, which are the TNBC cell line, will be cultured in a non-adherent serum-free conditions, and they are grown in a 6-well ultra-low attachment plate to help with the non-adherent condition. When breast cancer cells are grown in non-adherent condition, they will form a multicellular 3D spheres known as mammosphere. Following 14 days of culture, the mammospheres will then be undergoing MFV calculation. For mammosphere formation efficiency, the percentage of MFV is calculated by the number of mammosphere per well divided by number of cells seeded per well times 100. Next, the mammosphere will also be collected and they will undergo analysis of CD4 plus CD24 negative or low surface marker expression by using flow cytometry. Apart from flow cytometer analysis, RNA were then extracted from the mammosphere and then later converted to cDNA. This is to allow detection of SOX2 and OCT4 genes by using RT-PCR. So from the MFE results, we can see that our data shows that the MFE of mammosphere, meaning that the mammosphere that grown more than 50 micrometer in terms of diameter, formed from the MDA-MB231 cells increased significantly at day 7, day 10, and day 14 compared to day 5. And these are just photos from the mammosphere grown from the culture condition following 14 days. The flow cytometry analysis, it can be shown here is that the mammosphere generated had a lower proportion of CD44 plus CD24 negative or low cells than the monolayer cells. However, the percentage of the CD44 plus CD24 negative or low are still remain above 50%. And previous studies have shown that these MDA-MB231 cells actually in their monolayer state, they consist of more than 90% of CD4 positive and CD24 negative or low cells. So from the RT-PCR result, we can see that there was an increase in expression of pluripotency genes of SOX2 and OCT4 following 14 days of culturing, even though they were not significant. And this is when comparing to their monolayer counterparts. The OCT3, 4, and SOX2 genes are known to play a role in maintenance of pluripotency and cancer and self-renewal in embryonic stem cells. Or these two can also better be known as cancer stem cell markers. The previous study have shown that SOX2 could be upregulated in TNBC cell lines. So generally, this study tells us that breast cancer stem cells can be enriched from MDA-MB231 cells by culturing them in non-adherent, non-differentiating condition to produce mammosphere with retained breast cancer stem cell phenotype. And this will provide a platform for subsequent investigation into properties of breast cancer stem cells. So here are the references from my study. And that is all from me. So thank you. And if you have any question,